to this week's Interactive Virtual Experience, or IVX. This is the second session in a series of weekly peer-to-peer discussions on practicing during the COVID-19 pandemic. We are honored to have you here with us today. We're here to share best practices from one OD to another as we navigate the uncertainty around us. Last week's conversation got off to a wonderful start, and so I can't wait to hear all of your thoughtful questions this week. I just hope that my kids stay quiet during this session. I did bribe them last week, so I hope it works again tonight. My name is Dr. Carissa Lee, and I'm the head of professional affairs at Johnson & Johnson Vision. And just like you, we've had to pivot our business in the face of this crisis. Our goal is to always be here to support you and your patients. You can take comfort in all that AccuView is doing to help. Please feel free to reach out to your local sales rep if you would like more information. Before we start, I want to go through a little bit of housekeeping. We want to answer as many of your questions as we can. So throughout the discussion, you could submit questions. Just click the Q&A icon on your bottom bar and submit your thoughts. We'll also answer as many questions as we can, and if we can't get to them all, we'll certainly collect them and try to get them answered through future communications or through your reps. I was so happy to see all the chat traffic last week, so feel free to also use the chat module to share comments with other attendees. So let's get started. I'd like to now introduce you to Dr. Keith Smithson. Dr. Smithson is a distinguished clinician and consultant. With a specialty in sports vision, he's a team optometrist for professional sports teams in the DC area. He's figured out how to stay connected to patients during the pandemic and wants to share his thoughts with you. Please welcome Dr. Smithson.
Thanks, Carissa. Thanks for having me, and welcome to all the attendees, to all of our colleagues out there across the country. Hopefully you're all safe. Hopefully your families are safe. Obviously, that's the most important thing we could talk about on a day-to-day basis. But yeah, we're excited to have this conversation today, have this discussion about what's changing out there, how the world is completely different for us all today as it was a couple of months back. So I certainly don't have all the answers, but we thought it might be helpful to go through a conversation and a discussion about the different pillars of our practices day to day, what we deal with on a day-to-day optometric practice, and some of the tips that I've come up with that have helped us as a practice to stay connected with our patients. To give you a quick little background, we still have 5 offices. We have 13 doctors in our practice outside of Northern Virginia, in the DC kind of area. We're lucky to still be open. I know a lot of you out there may not be, but we are still seeing in-office patients. We're also doing a lot of telemedicine. We've had to innovate and be creative about ways of delivering services. So hopefully through some of the things that we've had to learn over these last couple of weeks, we could share some of those tidbits for each of you to take back to your practices tomorrow, and maybe still be able to connect with your patients in the way that we've been successful doing it as well. So thanks for having me, and excited to go through this conversation. So the first conversation we're going to have is really around this thing called telemedicine. That's really kind of an interesting thing for us. So we're going to frame this in a kind of 3-part format to talk about telemedicine and telehealth. We'll also then get into things like contact lenses and eyeglasses, which is obviously a critical component to all of our optometric practices. So how can we deliver contact lenses and glasses in today's world? And finally finish up with things like in-office visits. If you are still fortunate enough to be open with your local restrictions in your local state, how can you see safely patients in the office for either urgent care visits or problem-centered exams? We'll talk a little bit about what that means. So this is how we're going to frame the conversation, and at the end of it, hopefully some key things you can take back to your practices to make a difference tomorrow. So the first one we're going to get into is telemedicine. And we're going to do a quick little poll here about telemedicine, just so we can kind of see how engaged maybe you are currently with your practices in telemedicine. So let's go ahead and put the first poll question up. So in the first poll question, we just like to see, have you incorporated telehealth into your practice? And the answers are simply just a yes, a somewhat, and a no. So we'd just like to get a quick snapshot of where the attendees are in incorporating telehealth into your daily practice. So go ahead and click those in real quick, and then we can take a look and see what the results of that poll look like. Don't be shy, click away. There'll be plenty of chance for question and answer, as Dr. Lee said as well. So we'll get through some points that I think are relevant in each of these topics, and then we'll give you a chance to answer some questions that maybe I didn't hit on. So let's take a look at the results of that poll. All right. So yeah, I mean, pretty much what we expected. We're all kind of across the board, and really, it's an interesting world out there. So we're all, restricted, somewhat based on the state we practice in and what the restrictions might be. Our comfort level as far as delivering this telehealth is something that has been kind of near and dear to my heart. As Dr. Lee mentioned, I, have the good fortune of working with multiple professional franchises in the Washington, D.C. area. And so I've had a chance to practice some telemedicine for a long time with the teams that I work with. When an athlete might be on the road or having an injury, that's managed by an athletic trainer when they can't necessarily see me in the office. And we've had to talk about, what the symptoms look like and maybe take a picture and send it back and forth to talk about what might be going on, and then maybe initiate treatment when the athlete can't see me until they get back in town, maybe the next day or so. So we've had a little bit of telehealth going on for a long time in our practice, but certainly not to the level or scope that it is now. So if we look at, sort of my quick bullets on some of these ideas, for me, really, this goes back to a couple of different things. I think the first way to look at telemedicine is that it really is probably not going to go away. I mean, I think telehealth is going to be with us for a long time. I really do think this is something we have to find a comfort level with. I think very much like we did when we all were kind of forced down the EMR road. It was a bumpy road, but we all had to get away from paper charts and learn how to do things from a computer format. So I think we have to find a comfort level with this. Something that's been helpful for our practice is really just kind of imagining that patient is still sitting in front of you. I mean, we're sitting in front of a computer screen, but really trying to have the most authentic interaction you can as if the patient was still sitting there. So we still have a tech walk into the room. We have them go through some question and answer with the patient. We have them talk through their symptoms, maybe do a quick case history. But yeah, I mean, I think it's still important to have that interaction be as similar to what would happen in the office as possible. I think we can be creative with some of the testing that we do. I had a patient the other day, and I'm sure a lot of you are dealing with this as well, where people are complaining about headaches and eye strain and things related to so much computer work, so much near focusing that's really maybe probably more dramatic than they've ever been through before in their day-to-day world. And I really kind of had a history on this patient a little bit where there was always some underlying convergence stuff. And what I had them do was basically a convergence test right there in front of me on the telemedicine. And I could see the eyes converging to a certain point and then kind of losing focus. So we talked a little bit about some things from kind of a muscular standpoint. So again, I was still able to do a convergence test, albeit remotely. So I think we can be creative in our testing, talking about, can they see clearly? Well, do you see your phone clearly? Those are the things you're looking at day to day. You may not have a vision chart, but you have a cell phone. So use the things that you do have to get those clinical bits of data that can help you in your decision making. I think, part of this is really just being confident and really knowing that you can still deliver care. You are the expert in this sphere. You are the ones that are going to take this patient from potentially an anxiety-ridden situation that they're concerned about something going on with their vision, and be able to implement some kind of treatment strategy. So be confident to know that when you get the right data, you can take that data, do good things with it. And again, if you're concerned, if you hear something that just doesn't make you feel right, we've all had those situations where we didn't sleep well at night, hearing something from a patient that we saw in the office and worried about them. And what did we do? Maybe we called them, maybe we had them come back into the office a little bit sooner than we normally would. So I think, look, if you're concerned about something, you're really not sure if it could go down a worse road than what it seems, follow up with them the next day, have them call you back, do another conference. We're using the Zoom conferences as a way for us to do the telemedicine, and it's been very effective for us. So I wanted to give you a couple of those quick ideas from my practice. But Dr. Lee, are there any questions out there from others?
Yeah, let me look at the questions. Just a reminder, everybody, too, there's two buttons on the bottom. One is Q&A, and that's a great way to submit your questions to us. And then there's a chat button where you can talk amongst each other. So there may be some things that you can learn from colleagues that are on the line as well. So just make sure to submit the questions that you have for Dr. Smithson in the Q&A, and then I'll try to field them and read them back to you. So when you're doing telehealth or when you're practicing telehealth, how are you, I guess, how are you reaching out to them? Are they reaching out to you first? Is that how it works in your office?
Yeah, so we've posted on our website that we are involved with telehealth and telemedicine. We have those services. It's on our homepage. Any of you feel free to take a look at our homepage at novaidocs.com just to see what we've done. We've sent out things through social media to let people know that, again, that's a service that we have. We actually custom made our mailer that we generally send out just for patient recalls, just to say that, look, during our current situation, there are some differences in our practice. We didn't put the general, hey, it's time for your eye exam kind of thing, but we sent out something that said, in today's new world, our practice continues to be open. We're here for you, and these are the services that we render, and one of them being telehealth and telemedicine. So we're trying to reach out to them, but we're also offering this as a service when people are calling and saying, look, I'm really concerned about my vision or concerned about my eye, but I might, not be comfortable coming in the office at this point. They've heard about this from some of their other doctors at this point as well. So I think a lot of patients are actually calling us and saying, do you have that service? So yeah, I think both ways.
Great. Are you taking visual acuities when you're doing telehealth? And if so, how are you, is there a specific chart that you're using?
Yeah, so I'm personally not, again, and I'm going to give you as much as you want to hear from me and my personal experience. So as I said, there's 13 doctors in my practice. We're all doing things a little differently, just like every doc that works together in your practice probably does things a little differently during their exam. So I'm personally not using an eye acuity chart. Like I said, I'm going to be doing something more like, well, is your vision blurry when you're trying to read? What I'd like to say with the scores on the bottom of the TV screen, but there's no sports to watch right now, which is killing all of us. But maybe on the bottom of the news screen that you're trying to read across the ticker, or are you seeing more blur with your phone versus a distance target? So I'm kind of asking more subjective questions like that.
Great. Yeah, that's good to know. What about entrance tests? Have you been able to perform your entrance tests and feel confident about the results that you're getting through telehealth?
Yeah, I mean, I think, like I said, there's still a level of EOMs I think you can still do. I think there's still a level of, understanding and questioning the patient the way that you would before, maybe they're triaged and come into your exam room. But certainly you're restricted in how much objective testing you can do through a computer. And look, I think at the end of the day, as much as I feel like telemedicine is not going to go away, I think we still have to be really confident as a profession that this doesn't change the fact that we advocate for annual eye exams and how important that is to get these patients into the office to really be seen by us the way that they should be seen by us. So I think, there's some questions that we get about that. Are you concerned that patients are now going to stay home and call up and say, hey, can I get a new pair of glasses without coming in next year because we were able to do something this year? So I think you have to frame that by saying, look, these are extenuating circumstances. This is an unusual time. This is something we're doing to try to meet the needs of our patients with the challenges in front of us, but this certainly doesn't substitute for getting that patient in front of us and doing a full comprehensive eye exam.
Yeah, those are really great points. A question came up about insurance. So how are you informing patients about the services you're providing and whether or not you take insurance? What's that sound like?
So again, some of my partners have sat on some conference calls with AOA, with our local VOA here in Virginia, as far as billing and coding. We have a billing and coding department. Our practice is sort of a mid-sized practice. Again, like I said, 5 offices. We have 65 employees. So we do have a billing department that's been able to kind of research some of that for us. But there are a lot of different options that you have as far as providing telehealth. You don't necessarily have to do a Zoom conference or something where there's a computer-driven situation. Sometimes we get this question of, with an elderly population, are they going to be technology savvy enough to click on a Zoom call and follow that through? Well, maybe not. In certain situations, I've had that opportunity where we've been on a Zoom conference and they dropped the call or weren't able to click on the audio. So again, you pick up the phone and you call them, and there's multiple different ways you can code out that visit, depending on the length of the visit and the services that you rendered.
Yeah, and I would also iterate that there's a lot of great resources out there. So check out, like the AOA, I know had some webinars, and they have some information on their sites, as well as some states have different legislation or guidelines about how to practice. So just be sure to check in with your state and make sure that you're practicing well within your guidelines. Another question about insurance and telehealth specifically is thinking about how your staff fields those calls, or maybe that's you. What's the process look like thinking about insurance and contacting you? Can you walk us through a little bit of the details there?
Sure. I mean, it's something that, again, our front desk is confident about having that conversation at this point. They have the right talking points. And so, it's an option that they're offering patients when patients are calling us. And again, we're not generally reaching out to patients at this point and calling them about the time for their annual eye exam. So they're calling us with a concern. And when they go through that concern, if again, it sounds like something that can be potentially remotely dealt with, they're offering the opportunity for telehealth. And again, telehealth doesn't mean can't lead to a need for an in-office exam, right? I mean, after you've had that conversation with the doc, if they said, you know what, I really just don't feel confident giving you an answer or a protocol and treatment here without seeing you, and I really think it's worth any potential risk really because it's sight threatening or whatever it might be to get them into the office. So again, I think it's a conversation you have to have. You have to be confident about saying, look, your insurance is going to be billed for this. Your medical insurance is going to be coded out in an appropriate manner, but there's multiple different ways to do it. As Dr. Lee just said, plenty of different resources out there for you to become familiar and comfortable with the ways to code it out. But yeah, we're comfortable having that conversation, and many people are taking us up on that opportunity that have seen us for years and said, you know what, I feel like we probably can do this right now over the phone, but yeah, it's just an option that I think we have to be ready to have the conversation about and ready to administer.
Yeah, and there's a few questions about kind of the telehealth system or how you set it up, and I'll preface this by saying, you know, there's a broad scope of what telehealth or telemedicine is. I think, Dr. Smithson, as you were talking about, it could be a phone call, it could be something like utilizing a Zoom platform, and I know that the guidelines are a little bit different during this pandemic situation than they may be outside of it. Maybe can you walk us through how you decided to utilize a video platform versus, and maybe some of the other options that you may have looked into?
Yeah, I mean, for me, look, having a conversation with a patient over the phone is only going to give you so much. You know, as they said, you know, the picture tells 1,000 words, right? So if you have a chance to see them and see how red the eye really is, or how uncomfortable they may be in what they're talking about, may look very different than the patient's relating it, right? So I think for me, we were comfortable with having some kind of a video capability. Zoom, we were just comfortable with, you know, between my business partners and I, we Zoom conference to talk about business matters. So we were all just kind of comfortable with that. Obviously, as Dr. Lee said, it's not the only platform out there. We just felt like it was easy enough to use. And again, the way that we administer it, we have a floating tablet or a floating laptop in the practice that the technician, when they look at my schedule and see that, you know, the next patient up is a telehealth, they're reaching out to them. They're calling that patient on the telehealth system while I'm still finishing up with the patient potentially in the exam room. They're setting it up. They're asking some of those entrance questions. So just like I would rotate into a second office during an exam, when I'm done with the first patient, I'll go into the second room. The computer's up and the technician has already left and said the doctor will be right with you. And here I come walking through the virtual door, just like we do in a general exam. So I think, again, having a mindset that this is really no different than what we do day to day without the real benefits of getting into the eye and doing some of the objective testing that we can. But I think from a patient encounter standpoint, and for that patient's comfortability to really have that confidence of feeling like I can deliver a starting point of care here. We're not just guessing, but look, so much of what we do is based on that history and what the patient is telling us. And if you can see something as well, I think there's a benefit to that.
Yeah, that's great to know. One last question before we move on. Somebody's asking about checking in acuities and performing slit lamp examination to get reimbursed through insurance, or the requirements different for telehealth. So maybe if I frame that up differently, is how did you find out about what you can bill for telehealth, the codes that you use, maybe some of the resources or sites that you use to figure out what to do in your practice?
Yeah, I would tell you the rules are completely different. I mean, we had, like I said, we had our billing department and some of my partners sit on, I think the AOA call was one of the best ones that they had. The VOA tacked on top of that to give a little bit more of their local flavor to it. But the rules are certainly different. Obviously, you're not doing a slit lamp exam. You're not getting an evaluation of the retina. So there are other requirements as to the time that you spent with the patient. In our EMR, there's actually a button that none of us even knew existed at the bottom, which has something to do with the timeline that you spent with the patient. So there are things like that that you have to click in to be you know, sort of relevant and make sure that you're going through the right coding mechanism. So there are things like that you have to know, and we were able to put it together in a quick couple of slides that our billing department gave to each one of the doctors and said, hey, this is how you do it. These are the things you need to check off. These are the boxes we need to check for telemedicine. But to answer your question, yes, the rules are different.
Great, and unfortunately we do have more questions here, but in the interest of time, we'll move on to the next topic. But again, I'll certainly try to get as many questions out as possible.
Perfect. Yeah, and hey, look, you keep asking the questions. If this turns into something where we need to do a telehealth only kind of webinar later, we're open to do what we need to do. The next topic that we wanted to get into, though, is something that I think is really relevant. So I do want to keep us on pace because there's some other things I think that are really important to talk about here. We're going to talk about contact lenses and eyeglasses a little bit. So I want to do the poll question first to kind of get, again, feel for how we're contacting our patients and how we're interacting the services we might be able to deliver. So let's go ahead and do that second poll question first. So the second poll question has to do with how are you currently servicing your patients? So again, we can select as many here, but we want to say, look, are we contacting our patients or giving them communication through the website? Are we using phone calls and texts? Are we using a telehealth portal? Do we have curbside delivery options? Are we still seeing patients in office? Or the bottom one being none of the above, essentially because the office is closed and we haven't initiated any kind of telehealth at this point, but just giving us a quick idea of where we are out there, where the attendees are on the type of services that you're doing right now with your patients. So go ahead and take a quick look at that. Click on a couple of those for us, and we'll take a look at the results just to kind of see where we are. So let's go ahead and take a look at those results. Awesome. So a lot of phone calls and texts. I would tell you that's still a really important thing for us as well. I can't tell you how many people still miss their appointments because they were called on the phone or emailed, but not texted. So I think text is still a pretty important thing for us to do. Obviously, across the board here, we have a lot of people that are being creative and being innovative. And I think if nothing else, to innovate a little bit in our own practices and find ways to deliver health in ways that we didn't know we could before. So for me, yeah, that's a pretty probably reasonable snapshot to look at across the country and what our colleagues are doing in trying to continue that continuity of care, which is what we all yearn to get back to. So as we go through a couple of different points that I have on specifically glasses and contact lenses related to servicing our patients, again, that's hugely important for all of our practices to have a revenue stream and be able to supply patients with glasses and contact lenses. So for me, when we talk about contact lenses, obviously trying to direct ship contact lenses whenever possible is certainly a critical component, something that, pretty much every manufacturer gives you that opportunity. Pretty much every lens gives you that opportunity outside of specialty lenses and such potentially. But direct shipping lenses when possible takes out the whole contact for the patient or having them come into the office. Curbside delivery is a great option for us. We're fortunate enough to have in 4 of my 5 locations a really nice curbside. So we do have people that can drive up and get the product right out front of our office. The way we set that up is we have an initial conversation with them on the phone. We let them know that's a possibility. They contact us when they're in the parking lot and they say, hey, I'm out front. Can you come out and bring my contact lenses? And that's exactly what we do. We have a staff member walk them out front, give them to them through the window, and off they go. And again, sort of that no-touch society. So giving us a nice option with curbside delivery. I think another thing to look at is the previous stock that you've bought through different manufacturers to save a couple bucks here or there on boxes that's sitting in the back. If this is an opportunity to use up stock, it's a great opportunity. And patients obviously would love the opportunity to walk out with a contact lens box and not necessarily have to come back to the office or wait for something that's going to be shipped or delivered by, a UPS or FedEx mailman. They talk about those kind of conversations and contact points as well. So if you can walk out with that box while you're in the office, I think you feel better as well. What we've been able to do with this ship to home via EMR is something that we put in place, not necessarily knowing if our practice was going to continue to still be physically open. So we have access through our EMR as doctors to be able to look at those patients' charts securely at home. So we set up a process in place that we now continue to use that, because we've limited doctor hours, we've limited, some of our day-to-day operations, as weeks have gone by and we've seen dwindling revenue, we've had to be creative as to, how we man the offices. So we do still have this capability as well, where we're able to say, look, I can look back and see your prescription has expired here maybe a month ago, but it looks like you're running out of lenses. I understand it's a very anxious time out there. We certainly don't want people to feel like they can't drive to a grocery store or take care of their family because they ran out of contact lenses, right? And they have broken glasses. So, this is truly a public service and truly something that, changes people's lives if they can't see. So, we can look at their prescription. What we've been comfortable doing is saying that we would extend their prescription for up to 3 months, expecting that they will come in at that point to get a comprehensive eye exam. So we're direct shipping them 3 month supplies of contact lenses, given their old prescription, and letting them know again with a bit of a disclaimer that this is not the way that we generally do business. They understand, but they're very thankful the fact that we can get them product get them something we continue to see with until potentially it's a safer, healthier time that they can get into the office. We've done a lot of the similar things with glasses. We've done a virtual optical to try on frames. And so we'll go to that first, because for me, that was something that I kind of had to think through a little bit. We had never really done that before. There are a lot of virtual opticals out there, different companies that provide that service. So what we did was we partnered with a company that we could essentially send patients to, where they could try on virtual frames. They could upload a picture of themselves, look at different shapes and colors of frames, pick out something they wanted. This is the way, again, that we just did it personally. They send those frames into a PO box that I set up. And then we have a staff member from our office, since again, we are still open. We've had them call that patient, go through, their prescription. Again, talk about the fact that potentially it's an expired prescription, but we understand their glasses are scratched or broken and they need something new. And we're able to then talk about, lens options, what type of progressive lens would they might want, what type of lens treatments would they want, do they want a polarized lens or a photochromic lens, going through those options. And then the nice thing is at that point, we're able to pull their insurance as well and go through their insurance benefits. We take payment over the phone. And then essentially what we're doing is ordering the lenses into the office. Those frames that they ordered from the virtual optical come into the PO box. I bring them into the office physically every week. We marry the two together. We grind them, cut them, and put them back in a box to send out directly to the patient. So again, the patient didn't have to come into the office. They were too anxious to do so, but they had those broken, scratched glasses that now they can feel safe about seeing again. So that was our virtual optical experience that we created. Another cool thing that I think, was sort of a thinking point. We didn't really think about this before, everything with the different CDC regulations on cleaning and cleanliness, but what if someone comes into the office and is going to try on a frame, and then they try on another frame, and then they try on another frame, and all of those are going back over to the frame board. So what we came up with is a situation where if a patient's coming into the office, having an exam, or coming in to pick up glasses with a prescription that they might have from elsewhere, we give them the tray. And the tray is for them to walk around and browse. They can take frames off, put every frame that they've tried on in that tray. When they finally do sit down with the optician, they're able to go through the purchase, the sale, the ordering of the glasses, and then we take that tray back and we have that disinfected, have all the frames cleaned, have everything sanitized before they go back up on the frame board. And again, I think that's a critical thing for someone else who might be sitting in the office waiting for their eye exam, to see that we're taking those extra steps to keep everyone in the office safe, including the customers. So I think that was something we just had to think through, and something obviously we didn't do before. So that's a change to our day-to-day. One of the last things I would just throw out there as an opportunity is that we are supplying PPE frames and eyeglasses for our medical professionals. We actually created a program for first responders and for medical professionals. So we created a discount rate for them to be able to get non-RX or RX eyewear if they come into the office or provide us with a prescription, where a lot of them were using something that was not well fit, that was causing rashes and irritation, something they were given maybe by their hospital or whatever. So we're able to give them something that fits well, is actually made for these purposes, and then they deliver, the glasses, either, like I said, RX or non-RX, directly to those patients again. So it's just a cool community outreach, community service kind of opportunity for us to kind of work together with our healthcare professionals. And look, we're all in this together. So anything we can do to help from our end was kind of a neat opportunity for us to do. And we've done a decent amount of those too. So it's a cool opportunity if you can do that. Do you have any questions specifically on the glasses or contact lens stuff, Dr. Lee?
Yeah, there are quite a few. Let's just start by there's some specific questions about companies that you use. So too bad you don't have a vested interest in these probably, but what company are you using that allows you to connect the EMR that allows you to process the orders from home, and then also the company that you're using to try on these virtual frames?
Yeah, so as an EMR, we use OfficeMate. So again, it's just having a secure portal and working through something with our IT professionals that we can access that portal safely and remotely and securely. So again, it's the same thing as being able to pull up our EMR in the office. So there's nothing secret about that. It's just making sure that you're doing it in a secure way. As far as the frames and being able to deliver frames, there's a multitude of different options out there. VSP has their own iconic site. There's the glasses.coms and things like that. So we just simply picked one that would provide us with frames only. So we were able to order frames only, and we allow that to just be on the patient. We let them know that, look, if they are able to take your insurance, great, but we just took ourselves out of that scenario because we didn't want to invest the time, money, and effort to put in a virtual try-on frames ability on our website. We just didn't have the capability to do that. So we send the patient outside to a company to do that. And once they order, and again, you can look through multitude of those different opportunities and pick one you're comfortable with, but we just allow the patient to essentially buy the frame on their own as they're buying a frame only opportunity. And that frame only goes to the PO box. So they're handling that on their own. We just direct them to a site that we felt comfortable with. And then we contact them and we are processing the glasses the way that we would normally do it if they're sitting in front of us. So we're going through, again, their old prescription. We're talking them through different types of progressive technologies. We're talking through the different lens tints and options and things like that. So we're having that conversation with them, again, like they were sitting in our office. So I think we're still trying to keep that contact authentic in a very remote world. But that's how we did it. And again, I've had that conversation with many patients through the years on, what's the critical part for all of us as doctors. Obviously, the frame and the lens is the both, they go together. But if we have to give up something from a clinical standpoint, what we're most concerned about is making sure that the refraction is done right and making sure that that ends up in the glasses properly. So if we can control the lens manufacturing process, we feel good about the fact that we can deliver that. We put the frame together with the lenses. We measured everything to make sure that it looked right, that it wasn't off axis or whatever it might be before we actually sent that off to the patient. So we felt good about that.
Good. So there's quite a number of questions about sanitizing and procedures in your office. Again, I'd recommend CDC is a great resource. I think even the AOA has some, or your state association websites would have some guidelines too. But I think specifically I saw a few questions specifically around the disinfection of frames. Given that the alcohol can dry out some of the acetate frames. Is there anything that you're doing? Are you using UV lights? Are you, just some thoughts on that?
Yeah, so I mean, for me, look, and as I said, we're the experts on the optometric side, but talk to your opticians about what they're comfortable with on that as well, and bring them into it. Like Dr. Lee said, there's plenty of different resources that you can look at to find something that might be comfortable for you. But I would tell you that we have a multitude of different cleaning options that have evolved for us probably week to week as well. So we have different types of sanitizing wipes. We have, again, the ultrasonic cleaners. We have the alcohol when it's possible. We have different types of cleaners that you can use on different frames. So, I don't want to steer you wrong and ruin a $1,200 pair of frames you have in your office. So, again, you're the experts. It's your practice. So look into what you're comfortable with and just think about what can be used with that product to make sure that you're getting the desired result without ruining the frame.
Great. A question about the patient journey. Give me your thoughts on how this what your patient's journey will look like after when we start getting back to our new normal, right? I think that's kind of the question out there too, is it's going to be different in each state and each city. But as we think about getting back to our new normal, what are your thoughts on how a patient will walk through or go through your office?
Yeah, I mean, I very much expect it to be the same sort of encounter we had before. I think with just some enhanced cleaning and social distancing, options and things like that. I've talked to people before. I mean, look, we're healthcare professionals. We should have been cleaning and being hygienic about things before. I think we handle things obviously a little bit different than going into a retail, department store or something like that isn't familiar with this stuff. We should have had a lot of this stuff in place before. I think it's just enhanced. So I see it as that. I think that we're going to have patients come back slowly. I don't expect it's going to be floodgates that come back in once the restrictions are lifted. But I do think that we're going to have to be conscious of people's anxiety level is probably the best way to put it, that they want to see you taking precautions. I think we're going to be wearing masks for a long time. We're all wearing masks in the office now. We're having our patients wear masks when they come into the office. We're doing cleaning and hand washing in front of the patients just to reinforce for them that we are actually doing this. It's not the out of sight, out of mind scenario. We're having our technicians come into the office with all sorts of different wipes and disinfection opportunities between each patient. So they're seeing us take the extra mile, and I think that's really important for a peace of mind for them as well.
Yeah, there's also a couple questions on measurements. So thinking about these virtual fittings.
Sure.
Are you guys taking seg heights and PD and measuring for progressives during this? What are the specifics on that?
Yeah, so I'll give you my quick take on that. And again, this is the dreaded PD that each one of us have been, have to fight tooth and nail to keep our PD so it didn't go to an online optical before, right? And now we're just going to give it out. But look, these are patients that we've seen before. So we have something that's already been recorded as their PD from a previous pair of glasses. So we should be able to go through that and find that from their history. On the seg heights, again, we're cheating on that a little bit because look, this is our new normal. And I think that's, again, where our disclaimer comes in, that we let them know this is not how we normally make glasses. We're doing this because of the extenuating circumstances. So what we're doing is we're taking half the B, which is the vertical height of the frame. We're either adding 3 or subtracting 3. So adding 3 for progressive, subtracting 3 for a bifocal, a flat top bifocal. And that's our simple formula to at least get them in the ballpark. So half of the B height of the frame, once they, again, have to pick out the frame first and send that to us so we can see what we're dealing with. We take half the B plus 3 or half the B minus 3. That's our cheat.
Okay, got it. So last question, how are you keeping your staff or and yourself, I guess, safe during this time when you are showing them glasses? What are some of the precautions that you're taking right now as you have patients walking into your office?
Yeah, so this is great. I mean, we're going to get into this, I think, a little bit in the later segment as well. So I think ultimately, looking at the restrictions that are out there and the ways that we're supposed to be handling ourselves in day-to-day society, if you are in a state that you're able to get out of the home, so what we're doing specifically is we're having, again, every one of our staff members wearing masks at all times. They're not necessarily required to wear gloves, but they have that opportunity if they want to. We've installed shields in front of the slit lamp. So between us and the patient, there's a plexiglass or some material shield that's between us. We're asking questions when people are scheduling the appointments for an in-office visit. So we're asking travel questions. Have they traveled to a hotspot area? Do they experience any flu-like symptoms? The same kind of questions that a medical practitioner is going to ask them. And we're checking temperatures. So we're checking temperatures of all of our staff, myself included, every time we walk into the office and when we leave the office. So we're recording our own internal temperatures. We're also taking temperatures for the patients as they come in as well. So before they even have that first interaction with our technician, we're making sure that they're not running a temperature. So that's what we're doing. Good.
Great, thank you. Yep.
All right, so let's roll on to the last one here, because I did want to get into something here that really did some more specific talking points and thoughts around those in-office visits. So again, I think, we're going to get into a poll question before we get into these talking points a little bit, but, again, just want to kind of reiterate the fact that each of us are practicing in a different state, and there are different restrictions, different requirements out there. So please be mindful of what your restrictions are and what you're able to do. I'm certainly by no means giving you a license to go out there and do what I'm doing if it's not something that's allowed by your state. So please be compliant on those aspects. But if we put up this last poll question, let's just get a kind of a feel for where we are with this comfort level before we talk about in-office visits a little bit. Let's go ahead and do this last poll question. So a very quick one here on this one. Are you currently seeing patients in the office? So, and it's not just a simple yes, no, look at that. There's 3 of them in there. See, we're trying to throw you for a loop. So the yes, first of all, is yes, including needs for contact lenses and glasses or eye exams. And then yes, emergencies only, and no. So quick one here, pretty quick, but a question that a lot of us have stumbled over a little bit these last couple of weeks as this continues to evolve. So let's go ahead and click those answers in quick, and we can take a look at where we are all currently on seeing patients. So let's go ahead and put the results of that one up. Cool. Yeah, so I mean, pretty much what I expected and pretty much what we have done. Again, we've been fortunate to not have to close our doors at all through this process. So we started pretty much exactly, I would say, on terms with this. I would say that we've skewed a little bit now to have that top bar go up probably not quite as high as the middle bar, but maybe 2/3 of the way up. And I'll explain that a little bit, but ultimately that's pretty much what I expected to see. I think what we've come to is, again, an interesting concept. And our concept on scheduling patients to come into the office, as we talked about earlier, there's always that opportunity to afford them or give them the option of doing something remotely. So if they want to simply extend their contact lenses, I talked to a patient today who said, look, I've been in the same contact lens prescription for the last 5 years. I'm completely comfortable with them. I feel great. I really just don't feel comfortable coming into the office right now. And we, again, ordered her that 3-month supply of contact lenses until hopefully the world come back to a bit more normal and we can see her into the office. But, I mean, that's not everyone, right? So we give them those opportunities. But if it truly sounds like something where they need to come in, or maybe it's a new patient to the practice, their doctor's office is closed and they're not seeing patients, we came up with this concept of a problem-centered exam. So a problem-centered exam essentially meaning that the patient has to have a problem, that we're not bringing them into the office simply because it's a year. And I feel great. I've never worn glasses. I feel like I still see perfectly, but my year's up, so I feel like I should come in. We're not seeing those patients. Again, that's just a personal preference, and that's the decision I've made with my 4 partners and the other 12 doctors in our practice. So, again, we get on weekly Zooms to have these conversations. So we feel like at this point they have to have a problem, and we feel like that problem can be anything. So again, it's a difficult thing. If you really think about it clinically, someone who calls and says they have blurred vision, does that mean that they need glasses, or could it be potentially something much more serious? And how do we know without seeing them in the office? So again, there's multitude of different things that could happen with blurry vision, pain in my eyes. And again, there's a lot of anxiety out there in the world right now. So, I had a mother today that came in really literally shaking, wearing gloves and a mask and everything, just because she felt like she was going to go to see the MRI. I mean, she literally thought with the headaches that she was having that she had some kind of a brain tumor or something like that. Again, it's the anxiety of this whole society right now that took her to a whole different level. But by bringing her into the office, and again, she's 39 years old, doing 9 hours on the computer every day, and to find out that she needed a pair of computer glasses to finally relieve some of this strain that she'd never experienced before. I mean, you could see there's this weight fall off her back, and her smile walking out the door, even though, again, she was nervous to come in, to know that she was physically healthy, that we looked into the eye, the retina was clear, and that she simply needed a pair of glasses was something we would have known without getting her in the office. So again, we use this term of problem-centered exam to steer who's coming into the office and who's not. And a lot of times then that evaluation or that interaction with the doctor can lead from, kind of a basic, what we would call an office visit to more of a comprehensive exam based on, what happens once we see them and get a hold of them and start looking at some of the objective testing. We talked a little bit about our safety protocols on what we're doing with the entry point screening, what we're doing on the phone, talking to them and asking these different questions about their travel habits or how they feel as far as their flu-like symptoms. We talked about taking temperatures. We have a little handheld forehead thermometer. So again, no touch. It's done just a couple of inches away from the forehead and quick instantaneous temperature. Again, we're practicing social distancing. I think that's another big thing. People, if we've seen when you walk past them in the grocery store, they do Olympic maneuvers to sort of avoid you and dive out of the way. So, we've made sure that we put chairs, separated, 6 feet apart in the waiting room. Look, we're not seeing 20 people sitting in our waiting room right now. I don't think any of us are. It would be a great problem to have. But at this point, even 1 or 2 patients in the office looks like a lot of patients. So we're able to call the patients and tell them as well, you're coming in for your appointment at 11:30. Let us know when you get in the parking lot. And then we can let them know, what, the doctor's running 5-10 minutes behind. Why don't you hang tight in your car for a little bit? We'll call you when they're ready. That way we can bring them right in, take them right back to the pre-testing and get them right back in the exam room. So again, trying to limit that time in the office. And then again, the maximum occupancy rules, which I think again are pretty important. So again, at this point with the patient load that we have, we're working on a reduced schedule with reduced hours and reduced staff. So we don't have more than a doctor, a technician, a front desk, and an optician in any of our offices at any time. So there's essentially 4 staff members. So we can certainly accommodate up to 6 people in the office safely and still be under our 10-person minimum, which is our restriction for our state. So we've been able to kind of handle that and mitigate the concern of walking into the office with 3 or 4 extra people standing there. If people walk by our offices, they sometimes will stand outside and wait for someone to leave. So again, I think the social distancing, the maximum occupancy, and the PPE, and just making sure that you're doing everything to ease the minds of your patients, to deliver the care that we all want to be able to deliver. But in these challenging times, the most important thing is that we're all safe, that all of you that are on this call today are safe out there. The last thing I want is for any of you to tell me down the road that you got sick because of anything we had a conversation about. I want you to follow your gut, follow your heart, be smart, be safe, be healthy. But if we can deliver care to people that truly need it, I think there's some important things we do. We have an amazing profession and we change lives every day. So if you can do that in a safe way, again, we've been able to, and hopefully some of these tips can help with you for that as well. Do we have any questions on those specifically, Dr. Lee?
Yeah, we do. We have quite a few. Just wanted to also make a note that we've got a lot of people from all over the country. So just make sure that all of you, as Dr. Smithson's talking about being safe, there's different, I think, risk profiles in different areas around our country. So just please note that everybody should comply with whatever your local guidance is, and apply that to yourselves as well as your practice, knowing that we're all in this together, but we might be in different stages of the situation. There's a couple questions actually about the specifics around the temperature. So, what type of thermometer are you using, as well as what's a warning sign in terms of, have you given guidance to your staff or technicians, whoever's taking the temperature, to say, hey, if it's above X amount, we would turn them around, and what are you telling them?
Yeah, that's a good question. I haven't had the exact conversation with my staff on that. So, we're using just the standard temperature that would be anything over normal. And again, we're using a handheld thermometer. So that's the easy part of it. I don't know what the name of the brand of it is, but they're pretty easy to use. It's literally a one button push. You hold it an inch away from the forehead, push the button, and you get an instantaneous temperature. So I'm not sure if we give them specific numbers on who gets turned away, but anyone who runs any sort of a temperature, to my understanding, is turned away from the office until that's not the case. So again, that's our staff members as well. We don't want them in the office potentially getting someone sick as well. And we did have that situation. We did have a situation where one of our staff members in one of our offices ran a temperature, and we ended up sending him home, and he tested positive. So we ended up having to quarantine the office. We had to close the office, go through enhanced cleaning. So look, we're in this with you guys too. It's not like, we're immune to this thing. This is hopefully a very honest conversation that we're all having. So we went through this and went through the enhanced cleaning, had to close the office until that was done. We moved and shifted staff from other offices. In our situation, because we have multiple offices, because of that learning environment and what we learned from that, we're now keeping staff members in one specific location. Again, because if someone gets sick over time, 2 weeks from now, next week, whatever it might be, we may lose that office for a day or so, but we're not losing the entire practice because that person traveled between 3 different offices and potentially infected multiple different individuals. So again, that's something that we just made a decision for us that would keep us safe as a practice by keeping staff members in one location. So just another thought on that too.
Yeah, that is a great tip, and hope your staff member is doing much better now. So there is a question, it came up before, so glad I get a chance to kind of repost it again or throw it back to you again now that we have a little bit more time in this section. But this is talking about extending prescriptions and patients. So that I'm combining two questions here. One question is, I think that you addressed about your willingness to extend prescriptions, but one is specifically saying, what would you say to the patient who's requesting that you extend their prescription so they can purchase it from an online vendor? The other question was around somebody who clearly hasn't come in for a couple of years and wants an extension. So thoughts on those?
Yeah, I mean, again, these are my personal feelings. So, I would say, obviously, we'd love to be able to sell the contact lenses as well. We're all running businesses here and are trying to keep the lights on from a financial standpoint. So we'd love to be able to sell the contacts to them if possible. But if they're just dead set on buying them online, the end of the day is we still want these patients to have safe, healthy vision. And I think you just have to be careful about writing the prescription, 3-month maximum prescription. And that's what we just came up with as a comfort level, that we feel like 3 months is all we're willing to extend. Yeah, the tough one comes with a patient who hasn't been seen since 2016 and wants to get more contact lenses, right? So look, I'm not going to change your clinical guidelines. You guys are all colleagues of mine, and make the best decision that you can go home and sleep well with. For me, it would depend on the patient. If it's a patient I've known for 20 years that was traveling overseas, we're in a very international area. We have people that work for the State Department or the military, or gone for years at a time. So I think it's a case-by-case scenario, whatever you're comfortable with.
Yeah, great. Let me I'll actually pose this question to the group, because we have somebody here that says that PPE is very hard to find for them. Where do we go for resources? I'll actually ask people to comment in the chat room as well as Dr. Smithson, because I think as I've been talking to colleagues, it's been different in different areas. So this person is specifically in Michigan, but if anybody has any great resources for PPE, I think a lot of people are out there. Dr. Smithson, do you have any?
Yeah, I would tell you, we've seen a lot of different opportunities. And again, I have one staff member that's kind of been tasked with doing this, pretty much week to week. And we found different outlets, whether they be, just kind of independent and outside of optometry. We've had, vendors like Vision Source and Luxottica and some of these different companies that have reached out with an opportunity to provide us with PPE. Pay attention and ask the vendors that you generally work with. And there are opportunities out there. I think companies like Zeiss and things, we're talking about the filters in front of the slit lamp. So I think there are definitely some opportunities out there. You just have to look for them.
Great. And unfortunately, last question, are you supplying masks to patients if they don't have them in your office?
We are. We ordered an abundance of the just general surgical masks. So those are the ones that we're giving to patients on the way in. As clinicians, we're wearing the N95 masks. Or something personal that someone has made that that they feel like they're more comfortable with. Obviously, we have issues with fogging glasses and all that kind of stuff. So you have to find something that fits for you, that's safe, but also works functionally with you. But yes, we are giving bags to all the patients as they come in if they don't have one personally. Right. Perfect. So again, let's I know we're running low on time here a little bit, so I did want to get into a couple of the key takeaways. We're hoping that ultimately, this is one of those things that, it was a free-flowing conversation. We wanted to be as honest and forefront with you as possible as to what I'm doing in my own practice. Again, as I said, I don't have all the answers. We're just simply trying to do what we can do day to day to deliver patient care and be safe doing it. So hopefully some of those things are good for you as well. And hopefully those are some key takeaways that you can take back to your practice, make a difference, add some aspect to the practice that maybe you didn't have before, or maybe modify a protocol that you put in place to make you feel that much more comfortable, or deliver a service that you maybe couldn't do last week. So for me, I think the three things that we really wanted to make sure that you got from this is my opinion that telehealth is not going to go away. I really don't think it is. I think this is going to be with us for a long time. I think people are going to be comfortable about the fact that we can interact with them. My medical doctor has done telehealth for 2 years. And given me that opportunity. So I think it's been coming. It's obviously a little slow to us in the optometry field, but I think this is not going to go away. So I think we have to find a comfort level now with telehealth. It's a great excuse to do it, especially since we have a bit of time on our hands right now. I think the second thing is being creative. We've argued for a long time about how much business we lose to online contact lens and eyeglass retailers that are taking business away from us because they're doing things remotely and through the internet. So let's challenge ourselves to be innovative and find a way to add something to our social media or internet platform that gives the patients a way to purchase or at least interact with us about wanting to purchase glasses or contact lenses and not lose those sales. Maybe pushes us to do something we should have done before. Again, that's the silver lining in this, is that we've had to think outside the box and be innovative a little bit. The final thing is obviously being safe. As I said, the whole thing out there is that this is very much of an unknown. This whole thing that we're battling continues to change day to day. The information we get from listening to the CDC and our medical professionals is that this is a challenging virus, right? And there's just so many different aspects to this that I think can make us, not sleep at night if we think about everything. So be safe, do what you think is right for you, for your staff. The last thing I want is one of my staff members getting sick because of something we didn't put in place. So we are, again, as owners of this practice, staying up late and spending hours, talking to each other on, different Zoom conferences as partners, trying to find ways to make it better tomorrow than it was today. And so again, if those are things that you can put in place for your practice, great. If you don't feel comfortable with it, that's fine. We just hope that sharing some of this information might be helpful. So, Dr. Lee, do you have a final question for us?
Well, yeah, I do have some final thoughts too. And I thank you for everybody who've been posting them. Thank you for all of your thoughtful questions. We will continue to listen to your feedback so we can provide you with helpful events like this. Let's get another poll question, because we are curious about how you're communicating these days, and what's the best way for your sales reps to reach you? This is really about how can we get information back to you? How can you get information to them? So we'd love to hear what the best way is to reach out to you. We'll also be holding a clinical webinar tomorrow at 2 different times, at noon and 6 p.m. Eastern times, with Professor Phil Morgan on the topic of COVID-19 and wear and care of contact lenses. So for more information, please reach out to your local rep on that. Our next interactive virtual experience like this one will be taking place next Wednesday on April 29th. So if you go into the chat, you'll see a link to register there. Dr. Chandra Mickles will be our next speaker, and she'll explore what the new normal for optometry might be post-COVID-19. So we hope that you will continue to shape the future of this IVX series with us. Please take a minute to answer one last poll question where you can share what topic would be most valuable to our next events. I know we didn't get a chance to answer a lot of questions out there, so please, your voice is important to us, and we want to stay connected to you. So we'll continue to broadcast these national events, but please reach out to your local rep, because we're also holding smaller regional roundtable discussions. And this is really a chance for you guys to speak directly to each other and get some of those questions that we didn't get a chance to answer with Dr. Smithson. Certainly we can have other doctors in those roundtable discussions and talk about what matters most to you. So I would like to thank Dr. Smithson for all of his wonderful insights today. He is a true MVP. Have a great rest of your day, and please be well.
Be safe, stay healthy. Thanks, everyone.